Imagine a tiny parasite, barely visible to the naked eye, capable of causing immense suffering and even death. This is the reality of jiggers, a public health threat affecting millions globally. These small fleas burrow into the skin, leading to painful lesions and potentially fatal complications. Understanding jiggers, their impact, and how to combat them is crucial in the fight against this often overlooked health crisis. These parasitic fleas thrive in impoverished conditions, particularly in rural and marginalized communities. Lack of access to clean water, sanitation, and proper footwear creates a breeding ground for these parasites. Children, due to their vulnerable immune systems and frequent outdoor play, are especially susceptible to jigger infestations. The consequences of inaction are dire. Secondary infections, if left untreated, can quickly escalate, leading to amputations, sepsis, and even death. It is our collective responsibility to shed light on this silent epidemic and advocate for the health and well-being of those affected. Jiggers, scientifically known as Tunga penetrans, are the smallest known fleas. These tiny parasites live in warm, dry soil and sand, commonly found in tropical and subtropical regions. Unlike other fleas that bite and move on, female jiggers burrow into the skin, often of the feet, hands, and elbows. Once embedded, the jigger feeds on the host's blood, causing its body to swell to the size of a pea. This leads to intense itching, inflammation, and the formation of painful lesions. The real danger, however, lies in the potential for secondary bacterial infections. The open sores created by jiggers become entry points for bacteria, leading to serious complications like cellulitis, tetanus, and sepsis. Without prompt medical intervention, these infections can spread rapidly throughout the body, leading to devastating consequences. Secondary infections are the most alarming consequence of jigger infestations. The compromised skin barrier becomes a breeding ground for harmful bacteria, posing a significant threat to overall health. One of the most common complications is bacterial cellulitis, a painful skin infection that causes redness, swelling, and warmth in the affected area. Tetanus, a serious bacterial infection affecting the nervous system, is another potential risk. It causes painful muscle contractions, particularly in the jaw and neck, and can be fatal if left untreated. Sepsis, a life-threatening condition, occurs when the body's response to infection damages its own tissues and organs. Sepsis requires immediate medical attention and can lead to organ failure and death. The silent nature of these infections, often developing without clear warning signs, makes them even more dangerous. It is crucial to recognize the early symptoms of infection such as fever, chills, and increased pain and seek medical care immediately. Section 4. Vulnerable Communities, a Global Health Crisis. Jigger infestations disproportionately affect impoverished communities in developing countries. The lack of access to basic necessities, such as clean water, sanitation, and adequate housing, creates ideal conditions for jiggers to thrive. Children, who often play barefoot outdoors, are particularly vulnerable to jigger infestations. The lack of awareness about jiggers, coupled with limited access to healthcare, exacerbates the problem. Many affected communities lack the resources for proper diagnosis and treatment, leading to prolonged suffering and increased risk of complications. The stigma associated with jiggers, often seen as a sign of poverty and neglect, further prevents individuals from seeking help. This vicious cycle of poverty, neglect, and lack of awareness perpetuates the J. Section 5. Prevention and Treatment, a Shared Responsibility. Combating jigger infestations requires a collective effort focused on prevention, treatment, and community empowerment. Simple measures such as wearing shoes, regularly washing feet with soap and water, and avoiding contact with infested soil can significantly reduce the risk of infestation. Treatment involves the careful removal of embedded jiggers using a sterile needle or sharp instrument. Antiseptic solutions are applied to the affected area to prevent secondary infections. In severe cases, oral antibiotics may be necessary to combat bacterial infections. Raising awareness about jiggers their transmission and prevention methods is paramount. Educational campaigns targeting at-risk communities can empower individuals to protect themselves and their families. Improving sanitation and hygiene infrastructure, providing access to clean water, and promoting the use of insecticide-treated bed nets are essential steps in breaking the cycle of jigger infestation. By working together, we can alleviate the suffering caused by these tiny killers and create a healthier future for all. Remember, knowledge is power, and sharing information about jiggers can save lives.